Hi guys, let's see about radial nerve palsy today. On starting with anatomy, radial nerve is the continuation of the posterior cord of the brachial plexus and it is the largest nerve of the upper limb and it has roots of all of the brachial plexus from C5 to T1, and radial nerve is the most commonly affected nerve and it has best prognosis because it has mostly motor branches. So in the humerus, let's see the posterior surface. Let's imagine this is the right arm of a person and we are seeing the person from up behind. So this is here we will have the glenoid cavity, and this is the axilla, and this is the head of the person, which is a medial portion, and then this will be the greater tubercle, this will be the medial epicondyle, and this will be the lateral epicondyle. So from the axilla it enters the axilla in the lower border of the teres major, and here at the axilla it gives three branches. First is a sensory branch, posterior cutaneous nerve of the arm, and then two motor branches to the long head and the medial head of the triceps. In the anterior compartment, it supplies the brachialis, brachioradialis, and extensor carpi radialis longus. The extensor carpi radialis longus is the first wrist extensor which is supplied. So if damage is before this level, the patient will have wrist drop. If it is beyond this level, the patient will not have any wrist drop. So after that, after supplying in the anterior compartment, it comes in the lateral epicondyle, where it divides into the superficial branch of the radial nerve and also the deep part, which is the posterior interosseous nerve, which pierces the supinator muscle and enters the posterior compartment of forearm. In the posterior compartment of the forearm, it supplies the supinator, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis and longus, and extensor indicis. And the superficial branch, it supplies the skin, it passes the undercover of the brachioradialis and it supplies the skin of the lateral side of the dorsum of the hand and lateral three end of fingers, except the fingertips, which will be except the nail bits, which will be supplied by the median nerve. So very high radial nerve palsy occurs at the level of axilla. It occurs in touch palsy, so we will have inability to extend the elbow, wrist drop, sensory loss, and finger drop and the thumb drop. In high radial nerve palsy, which occurs at the level of spiral groove, it mostly occurs in shaft fractures and also in Saturday night palsy. The patient will have wrist drop, sensory loss, finger drop, and thumb drop. In low radial nerve palsy, at the level of lateral epicondyle, the patient will have sensory